This is what life used to be like for Richard McGurk. For nearly 3 years, a 65-year-old could barely hold a conversation without a coughing fit, and even worse.
Whenever I laid down to go to sleep, it wasn't more than 10 or 15 minutes before I woke up in a coughing fit.
The chronic cough led to sinus infections, bronchitis, pneumonia, and asthma. Still, doctors couldn't find a cause until Richard came to see Dr. Richard Lazzaro at Lenox Hill Hospital, who suspected the real cause of the cough was that the cartilage in Richard's trachea had softened with age and was collapsing when he exhaled.
A collapse of the airway where the opening closes to greater than 90% of its normal size.
It takes a special chest scan called a dynamic CT to diagnose a condition called tracheobronchomalacia, thankfully shortened to TBM. Then Richard became the first patient in the world to have his TBM repaired robotically. It's an operation that used to be so invasive most patients refused it. Now the robot allows Dr. Lazzaro to stiffen the softened trachea
by sewing a mesh that's woven out of suture material to the back of the trachea and the bronchial tubes that adds rigidity. And over time, more scar tissue will come down and make that support structure more durable.
Richard's cough and related medical problems are gone, and he says he sleeps like a baby. He's overwhelmed by the difference.
Man, such a game changer. I just get it.
Saved your life?
Now, since that first surgery, Dr. Lazzaro has performed more than 50 similar operations. He says TBM is under and misdiagnosed because it looks like so many other lung conditions. But if there's a chronic cough and medications don't work, a dynamic CT scan could reveal the real diagnosis.